All right. Well, if you like your sanity, you don't want to drive yourself crazy, then you did not watch the Senate Finance Committee testimony with RFK Jr. But I think it's important, kind of indicates where we are in a country. So I'm going to give you a 30-second recreation of that. I'm going to save 3 hours of your life. So, 3 hours of testimony, politicians at their politician-ish. I mean, there are perfect politicians, 100% double speak. Words don't mean anything anymore. So here's how it went. 3 hours and 30 seconds. Today is Friday. I never said it was Friday. You're putting words in my mouth. I don't know what you're talking about. You're an idiot. There you go. That was pretty much it. That was 3 hours of politicians saying, "Oh, I never said that. Oh, you said that. I've got it. Well, I've never said that. You're mischaracterizing me. You're an idiot." So that was it. 3 hours. Words no longer mean anything. Statements no longer mean anything. That is if we let them get away with it. So that's what we're going to talk about today. And since what we do on this channel is help you get your Social Security, your Medicare, Medicaid, and all the rest of it, we're going to, focus on those particular issues. And that way, when we hear them BSing us and we think it's BS, we will know it's BS and we'll have the facts to kind of back us up. So I'm going to get into three different things. Regular viewers know a couple of these. If you're new to my channel, welcome. This is also a live Q&A. If you're watching this or recording, you're going to say, "Oh my gosh, Ed talks about an hour on this stuff." No, it should only take about 5 or 10 more minutes. And then we're going to do a live Q&A and help you all make sure you get everything you can from Social Security, so retirement benefits, disability, Medicare, Medicaid, help you navigate the bureaucracy. Okay, fraud, waste, and abuse. These are the new magic words in 2025. A politician, all they have to do is say fraud, waste, and abuse, and abracadabra. They can do anything they want because we let them. So, but let's talk about the fine print. One of the things that was mentioned yesterday during this 3 hours, and yes, I'm a glutton for punishment, so I watched it. Anyway, so Medicaid double dipping. So people say, "Oh my gosh, the reason Medicaid needs to be cut and billions of dollars, $1 trillion needs to be cut with Medicaid," which it did in the one beautiful bill. And I always try to be fair here. The one beautiful bill, actually, I found something that it is going to do good. So I'll talk about that. So the double dipping. So they characterize it, they said about 1.2 million people are double dipping Medicaid. It's like these 1.2 million people that are, essentially poor, low income, low resources, that they're getting two Medicaid checks or something like that. They're defrauding the system. And so that's why we need to cut trillions of dollars from the system. Here's the fine print. What it basically is if you're receiving Medicaid in one state, let's say Oklahoma, and then you move to Texas, and then you apply for Medicaid in Texas, the previous state, even if you notify them, sometimes it takes a little while for them to process it and cancel you out of that previous system. The current system, the way it is, they only do it like every quarter, so you might get double dipped, as they call it, for a month or 2 months, and then it catches up, and then they cancel you out of the Oklahoma system. Do you get an extra check or something like that? No. If you go to the doctor in Texas to get some type of surgery or procedure, does that doctor get paid twice? No. Do you get a benefit twice because you're in Medicaid in Texas and Oklahoma? Of course not. The only thing that happens is the insurance company, the management organization in Oklahoma gets paid, and the Texas management company gets paid as well. So it is waste, but is it necessarily fraud on the part of those Medicare beneficiaries, many of which they do notify? They say, "Hey, yeah, I'm moving." Obviously, when you move, you have to tell everybody that. And when you move to Texas, then you sign up for Medicaid. And then what should happen, and this is a good thing about the one big beautiful bill, they say, "Hey, Texas, if the people forget to notify Oklahoma that they have moved and they're not kicked off the system, and the new health insurance company is not paid, make sure that it doesn't paid, then we need to set up something to where it's automatically taken care of." So the one big beautiful bill is doing a good thing there. They're saying they're setting up a national clearinghouse. It's amazing why they haven't had that before. They had it for food stamps. So if you move from one state to another, there's a national clearinghouse that cancels you out of the previous one, but not for Medicaid. And so that one's going to take effect in 2029. Not sure why it's going to take them that long when, Doge says, the computer geniuses said we can rewrite one of the most complex computer systems in the world, Social Security, in 6 months. They supposedly can do that in 6 months, but they can't. Yeah. Anyway, so it's double dipping, but it's more double dipping in terms of the Medicare insurance companies. It's not necessarily fraud, but again, they use that. They use things like that. Is there double dipping? Yes. Are the people those poor people that are receiving that, are they getting any extra benefits? No, of course not. But it is a abracadabra word politicians use to go ahead and cut trillions of dollars out of Medicaid. All right, so regular viewers know about this next one, Social Security death benefits. So when someone passes away, the whole thing about Elon Musk and, people over 120 years old receiving Social Security benefits, that's been proven false. There's a handful of people out there that still believe it. Elon Musk is not one of them. The current commissioner of Social Security, the previous commissioner of Social Security, they all, that's not, nobody believes that anymore. But here's how politicians play this. They say, Social Security is so incompetent. They pay deceased people every year billions of dollars. Yes, Social Security does. Yes. If you pass away today and your check is due tomorrow, you're going to get your check. Because a person passes away, it goes through the state, the coroner's office or the funeral home. They notify the state notifies Social Security Administration, the Social Security notifies the Department of Treasury. All that happens really, really quick. And the Department of Treasury stops the check. If the check was supposed to come next month or next week or 2 weeks from now, then they usually stop it pretty quickly. But if it's deposited like the next day or the next few days, then it's deposited. So yes, Social Security does pay people who are deceased. But then if anybody out there, I'm sure a lot of people can attest that you just leave it in the bank account and the Department of Treasury grabs it out of there. So if you ever have anybody in your family that passes away and you're wondering to do with the last check, don't do anything. Just leave it in the bank. And if you're not entitled, if that person wasn't entitled to that last check, then the Department of Treasury would just rip it out. So, and it's important to know that the person has to be alive the entire month. So, and Social Security checks come a month late. So a July check comes in August check comes in September. So if that person is alive the entire month of August, then the September check, that's theirs, or their estates or their spouses or whoever. They're entitled to that benefit. If they pass away on September 2nd, then they're not entitled to the check for October, but they are entitled to that check they receive in September. So a lot of people get confused about that. So does Social Security pay people that have passed away? Yes, every single day, but they get it back, right? So that's another way politicians throw out a term like that and throw out fraud, and a lot of people buy it, not our community here, obviously. And another thing, the big picture, we always try to focus on the big picture as well, the trust fund. And politicians say the trust fund is gone, it was stolen, yada, yada, yada. And all they have to do is look at the Social Security trustees report that just came out about a month or so ago. And the trustees, yep, it's still there. It's about $2.5 trillion in the Social Security trustees. They just audited themselves, $2.5 trillion. There was $2.6 trillion. And then money went out, $1.3 billion went out, or $1.3 trillion went out, and therefore that depleted the trust fund. So that, about $1 trillion or so goes out every year to Social Security, and most of the money that is paid out in your Social Security check comes from people currently paying into Social Security. So this year it's about 90% or so. So if you're receiving a Social Security check, 90% of that Social Security check comes from people paying FICA tax this year. So the other 10% comes from the Social Security Trust Fund. and the trust fund. So if you believe this trust fund was stolen or something like that, then please give that 10% back to, some charity or something, because that's where that money comes from. It wasn't stolen or anything like that. The money is there. It's just that it's just like any savings. If you've got, $10,000 in savings and you use a little bit every month, that's not magic. It eventually disappears. Same thing with the trust fund. It's basically a savings. And the whole idea about incorrect payments, Social Security has been audited many, many, many times. When I ran my office, our office was audited many times, passed with flying colors. Social Security has about a 1% incorrect payments. And I did a video yesterday about those people receiving Social Security disability insurance. And most of the time, I would say in my personal experience, about 70% of the time, people got paid incorrectly on disability. It was because of the system. It's very, very complicated. So that's why I did an hour yesterday talking about disability and your ability to work on your disability. And then also the fact that those receiving retirement benefits early, sometimes those people voluntarily get overpaid. And you're like, voluntary go over? Nobody would get voluntary overpaid. Yeah, people do it every day. The limit is $23,400. And some people say, well, I'm going to make 24, 25. I'm going to make about $1,000 or $2,000 over. So I can get on the phone with Social Security for 3 hours and call them up and tell them I'm going to be $1,000 over, or I'll just let it ride, because I might not be $1,000. I don't know what's going to happen in December. I might lose my job in November, get hours cut back or something. So I'll just let it ride. And then when they do their taxes, Social Security sends them a little nasty gram that says, hey, you got paid, $1,000 too much. We hold back $1 for every $2 you go over. Cut us a check for $500, or set up a payment plan, interest free. So yeah, people do that every single day. But that's counted against Social Security, that Social Security is giving out incorrect payments. No, they're not. In that particular situation, people are voluntarily, picking incorrect payments. So anytime politicians, that's one of the things politicians do, is they overload us with all this information and, machine gun fire stats and misinformation and half characterizations. And then we start believing them, and words no longer mean anything. And it's not Friday. And I never said it was Friday. You can't prove I said it was Friday. So there's that. All right, let's get into some actual questions, and I can come up with about 400 other fine print magic words that politicians use, but we will go with some questions here. And so if you got any questions, make sure you ask them. Let me see. I am 65, and pharmacy said I needed a prescription for COVID vaccine in Utah. Yes. Part of the CDC and the new guy in charge. There has been a lot of talk about the vaccines, and and I think the next person says in the state of Nevada, you can't get it. Yes, that is a fact. So that is that whole anti-vax thing, and in Florida too. So I know what's going on with Florida there. So let's see. My grandson has Down syndrome on SS disability. He is turning 18 this year. Is there anything we need to do when he turning 18, or will there be any change when he turns 18? Yes. What happens, he's on child disability benefits, whether that's SSI, it sounds like, is that SSI or SSDI? But either one, they need to switch it from a CDB to a regular adult disability claim, a child disability benefit to a regular. So what happens is they will convert it at the age of 18. So normally, if there's actually employees in your local office that do that type of stuff, they're supposed to be taking action to convert it to an adult disability claim, because there's different qualifications. Now that you're 18, you're able to work and stuff like that. So they have to look at different things. They might send you some forms of what new doctors you've seen, any type of new prescriptions, any new conditions, or anything like that. So they need to start working on that. And they're supposed to do that automatically. But because Elon Musk and Doge cut so many staff from offices, I'd hate for them to miss it, and then your grandson loses benefits for however many months until they are able to take care of it. So that's an unfortunate part of this whole nightmare we're going through. So I would contact your local district office and tell them that. Again, it's, it has to be done. It has to be done. But it needs to be done sooner rather than later because it takes months for them to go through the whole process. So Down syndrome and stuff, it'd be a pretty easy one, but it needs to get started. So there are no stoppages of the benefit check. So reach out to them and say, hey, son's turning, 18. When are you going to send me the packet so we can fill it out and put any new doctors or prescriptions or anything like that? So yes, please, let's get it started. I wanted to know if you have a dual plan with Medicare and Medicaid and lose the Medicaid, will paying the 185 actually this year out of your SSDI, will that enable you to keep the benefits that come with? Okay, so if you have Medicare and Medicaid, then yes, you're dual eligible. So you can get that Medicare Advantage dual eligible plan. I always recommend the Medicare supplement plan, N or a G, but if you have Medicaid, you can't get one of those. So the only thing you can get is a Medicare Advantage plan. But if you lose Medicaid, and even if you're downgraded, because Medicaid has several levels, it depends on your state. This is one of the things that our new platform, we're coming together to help people. Y'all are going to help each other out and make sure, you're able to beat the democracy back into submission. But there's several levels of Medicaid. And if you're getting your $185 paid by the state, then you're in one of the higher levels. So if you're kicked off of Medicaid or put into a lower level, then you might lose that $185 assistance you're getting every month, and you're going to have to pay for the $185 yourself. And a lot of people, if you're receiving Medicaid, you probably not going to be able to afford that $185 a month and all the other charges. Because when you lose your Medicaid, the higher levels, you also lose your Medicare Advantage dual eligible plan, which those usually have more benefits than a regular Medicare Advantage plan, a lot more coverage because you've got Medicare, Medicaid, and the Medicare Advantage dual eligible plan in there. So, but in terms of SSDI, nothing's going to affect your SSDI. You're going to still get SSDI. None of that affects your SSDI at all. You're just going to lose the $185, and if you have one of those grocery cards with your Medicare Advantage plan, then if you lose the dual eligible plan, you're going to lose that grocery card too, and that might be another $100 or $200 hit to your monthly. So it's important if they kick you off that, which a lot of people are going to get kicked off here. They can't cut $1 trillion out, out of there and say, oh yeah, that was only 26-year-old gamers playing in their parents' basement. No, that's not $1 trillion. That's probably about 3 or 4 or 5% of the overall budget. The other 95% is going to be everybody else. The math there just doesn't math. So if you think you're supposed to keep Medicaid and they kick you off, which is going to happen a lot, unfortunately, you need to fight it. You need to fight it. And that's what our new platform that we're building right now is going to help you do that. But if you lose it, then those are the repercussions, unfortunately. So, and you can reach out to the chapter there, our sponsor, and they're helping, with their sponsorship. That's how we're building a new platform and our website and all that helps. So. Do you have to have your medical records when open the SSDI claim, or do they send forms for you to complete and take to doctor? You don't necessarily, when you open the SSDI, so when you file for SSDI, you go to, online or the local office or something like that. Yeah, you should have the names of your doctors, what you saw them for, when you saw them, what prescriptions you're taking and stuff like that. You don't necessarily have to provide medical records. But what you will do is sign an SSA 827, authorization to release medical information. And that you sign it pen and ink or through the internet, an attestation, and they use that 827, that authorization form. They send it to your doctors to get all that medical records directly. So you don't need to go out there and get all that stuff. Social Security will get that for you, no problem. Let's see here. Bonnie. You're so right, Bella. I believe they want to confuse everyone and then everyone is frustrated. Yes, Bella's always right. Yes. Bonnie's always right too. You guys are awesome. Got an awesome community. Yeah, that's the it's to flood the zone. Is to give so much information out there. That Joseph McCarthy, during McCarthyism and stuff, he kind of did that as well. He just told so much incorrect BS that you just can't keep up with them. And that's the policy nowadays. That's one of the reasons in this channel, we've got a lot of things in this country we need to address, but we're one trick ponies. We want to make sure our Social Security is protected, our Medicare and Medicaid. A lot of seniors are on Medicaid. So we want to protect those. So we are kind of one trick ponies in that response, in that respect. Let's see. You've never been overpaid. Good. There are no stupid questions. That's right. I give stupid answers, but anyway, so there's that. I have Medicaid, but now I am over the new limit. I was denied those benefits. Yeah, and each state is a little bit different. I know. I think the in terms of the threshold to be eligible for Medicaid, I think Alabama's the worst, is about under $1,000. Texas is just about $1,000. So if you're like in another state and you're like, I'm making $1,500 a month, and I get Medicaid because I'm only making $1,500. Well, if you were in Texas, sorry. And what's bad is that everybody in Texas pays for it. Texas pays about it. It's been calculated. Everybody in Texas that has health insurance pays about an extra $100 a month for health insurance because Texas decides to, not give health care to other people. So those people still get sick, they still get injured, and they go to hospital, and the hospital gets stuck with that, and it just increases prices for everybody. So yeah, Texas does it. If you think of the stupidest way to do it, that's what Texas. And I went to high school in Paris, Texas. So yeah, so sorry, Texas. Do you have a site I can send a question? Yep, right here. You just did. Let's see. What trust fund will CMS Dr. Oz pay to those tech company for the pilot 6 years Weir program? Did Congress approve this pilot program? Yeah, the congressional oversight. I think I remember that sometime in history. Yeah, that's pretty much seems to be gone nowadays. Yeah, so there's 6 states that are doing prior authorizations on original Medicare now, and again, under the guise, the magic words of fraud, waste, and abuse, that there are certain procedures, and I'm sure there are. Yes, is there fraud in Social Security? Of course there is. Is there fraud in Social Security disability? Of course there is. Is there fraud in Medicaid? Of course. Is there fraud in private insurance companies and credit card companies and Wall Street? No, not in Wall Street. But anyway, is there fraud everywhere? But for somehow, when it comes to the government, we like throwing the baby out with the bathwater. Oh, there's fraud. Well, let's go ahead and throw it all away and give it to Wall Street because, yeah, there's no fraud on Wall Street. So they'll do a better job. I had COVID one time. I've received every vaccine since they came out that prevented me really getting sick. Yep. Let's see. Not great. Poor son is not doing well. Wow. Wow. Get some Social Security from a friend's mom. My Direct Express card got hacked somehow. Oh my gosh. Okay, I want to do. I want to talk about one thing I saw on social media. So there's a lot I've seen on social media about Social Security checks ending this month, and that you have to act by October 1st, or your Social Security check is going to end. And okay, let's clear the air on this. This is more social media, people trying to get clicks and stuff. A lot of these are AI driven, just trying to get clicks and views and whatever the case may be. So here's the deal. Social Security checks, those paper checks, according to right now, the current Social Security Administration, they institute a policy and then they change it about a month later. And so as of right now, September 5th at 3:25 p.m., if you're receiving a paper check, you need to do something. A paper check. If you have your money direct deposited into your bank account, or if you have a direct express card, You don't have to do anything. So that a lot of AI social media people out there are saying, oh, you have to act now by October 1st or your check is going to stop. You have to do this, that, and the other. And what happens, these social media people, I say this every single time, you're ruining it for everybody, because you're going to freak people out, and then they're going to call Social Security and they're going to say, hey, what do I have to do to get my check? And my check is going to stop. And that delays everything. So people that need to file for disability, for retirement, for survivor benefits, for surviving child benefits because their parent passed away, they can't get in and get helped because people throughout the country are calling based on this BS social media garbage about everybody's check is going to stop at the end of the month. So please, I appeal to you, stop it. I've said that a million times that they don't stop it. So anyway, some of these companies are AI companies from overseas that are doing this. So your check, if you're receiving a paper check, then you have to do something. Only if you're receiving a paper check in the mail, the one with the, Statue of Liberty and all that. If you're receiving those, then you have to get a direct deposit. So either get a direct deposit. There's a lot of the times people don't get a direct deposit because they've, financial reasons, they've messed up their credit history and they can't get one. There are some banks out there that will give you one if it's for a government deposit type thing. So check that out. Or you contact Social Security and get a direct express. It's like a prepaid card that Social Security administers. Or you go onto the Social Security website and you can, there's a link there for the Department of Treasury that if you just have to have a paper check, you can file an exception and say, hey, I live out in the middle of the desert. I don't have any banks. I want a paper check. I want my paper check to continue. So everybody else, the other 99.9% of the people that already received direct deposit or whatever, you don't have to do anything. You're good. Don't call Social Security. Don't do anything. You're good. Other than call your politicians and make sure your check doesn't stop in the future because the trust fund is running out. But that's, 7 years from now. But we need to do something immediately since we've had 40 years to fix it and we haven't fixed it. But in terms of immediately your check ending this month, it's not going to happen. So there you go. So I just want to put that out for everybody else. Is the SGA limit for SSDI passive income plus work earnings crossing the 1620 or just earnings if passive cross? Passive, no passive. So investments or 401ks or anything like that, no. Cryptocurrency, no. It's only earned income. So Social Security defines disability as inability to work. It doesn't say inability to invest. So it's only the inability to work. So if you're working, then that talks about, disability. But as I talked about yesterday, as you mentioned, James, the 1620, you can work and collect disability benefits, but there are limitations. And that's where a lot of people get overpaid and incorrect payments is people just don't understand. You understand, it sounds like. You're allowed to make up to 1620. The first 9 months, the trial work period, you can make as much as you want. So, but I did a video on that yesterday, and on my website, I also have a lot of information on the disability program about working and collecting Social Security benefits. So you just go in there and click on that. I've got a calculator and a PDF that you can download and use, and it's 100% free. So information on retirement, disability, survivors, overpayments, living overseas, veterans, Medicaid, myths debunked, living on Social Security alone, all free. The only thing we do charge for is I've got a retired Social Security employee that she answers. She does one-on-one calls. Then yeah, she charges for that, but that's the only thing. Everything else is free. So use it because y'all sponsor, because y'all people like Chapter Medicare help us, and they sponsor this live Q&A, which pays for the website, and it's going to pay for this new website that's costing tons of money, but it's going to help a lot of people out. I just stated relaxing my whole sanitizing everything. Okay, all right, let's see. We've got some private conversations going on there, but that's a beautiful thing. Let's see. I really don't understand how you can get both. Not sure what you're talking about both, but this is an important thing. And this is why a lot of people are not getting the benefits they need, and they're struggling because of it. In a lot of circumstances, you can get 3 checks from Social Security. Yeah, a lot of people don't realize that. But one offsets the other. You can't get 3 full checks, but you can get, you can get SSI and SSDI. You can get SSI and regular retirement benefits. And then you can get Medicare, and then you get Medicaid, and Medicaid pays with $185. So a lot of people miss those things. And you get the low income subsidy or the extra help with prescription drugs that help you pay for your prescription drugs. And then you might be able to get one of those, grocery cards that you see advertised all the time that actually do exist, but the way they advertise them is pretty crazy. Yeah, really bait and switch type stuff, but they do exist. Depends on where you are. So you reach out to chapter and they can help you out. Social Security should have always been on a networking from state to state like the DMV, and the correct information should be there unless the state doesn't have networking computers. Yeah, Social Security is a national system. It's all networked. So, yep, PCOM, MCS, MISIX, yep, it's all, yep, it's the biggest computer system, one of the biggest databases in the world. Yep. And Social Security has been begging Congress for decades. We really need to update it. We are, running on, 1970s technology, Fortran and COBOL. We really want to update it. Please give us the resources to update it. And Congress has continuously said no because they don't want it updated because they setting up to fail. Let's see. Find some people I don't recognize. Jan, thank you for helping us navigate an already complicated system. Received notice that insurance was purchased by another company. Is this adequate change to enable my returning to? No, usually not, unless they cancel that particular plan. And that's what so you got that's probably not the ANOC. So I did a video a couple of days ago about the annual notice of change. If you have a Medicare Advantage or a prescription drug plan, you're going to receive a letter this month. And then Ari and I from Chapter talked about this as well. That's probably not the notice of change. But if the new company decides to cancel the plan that you currently have, then yes, you can return to original Medicare Part A and Part B and get one of those Medicare supplement plans without having to go through health underwriting. So there's about 1 million people that are going to receive that letter of cancellation. And a lot of people there's some people that are very, very happy that they're going to be canceled. That means they can go back to original Medicare and get a Medicare supplement plan. But the Medicare supplement plans, the reason a lot of people don't get those in the first place is, number one, they don't know about it. Another thing is there's a monthly premium for those. And some people they just can't, they just can't pay that extra premium, plus the 185 and the prescription drug plan and stuff. So, man, I'm getting scared of being kicked off of that. That'll make me homeless. Yes. Yeah, and it's called bureaucratic disenrollment. So you've got a lot of people out there that are fully eligible for Medicaid. They have low income, low resources, but they are still going to be kicked off of Medicaid, even though they're 100% eligible in their state. Why? Because that's how it's designed. They're going to make it so difficult and cut resources. They're going to make you jump through this hoop and this hoop and this hoop and this hoop. And if you miss it, if you forget to check this box or date it the wrong date or something like that, then the local office, the local Medicaid office, wherever you are in the country, has very little staff. They've been cut back substantially, and they're not going to be able to help you correct it. And then you just might lose Medicaid. If you fight, then you'll get it back, but that might be a month or 2 months or 3 months, and you're completely stressed. And what are you going to do with your prescriptions and all that? And this was part of the big, beautiful bill. One of the things that was going to be instituted was to make it easier for you to keep your Medicaid, but they decided that, to make it easier is not a good thing. So they delayed that for 10 years. Yeah, So we'll make it easier for you 10 years from now. For the next 10 years, we're going to make it as difficult as we possibly can. So that's why we're coming up with this new program. So I have a question about survivor benefits. If I go ahead and take my Social Security at 62 and my husband waits till 67, his full retirement age, then he passes, will I get his full benefit? If you are your full retirement age at that time, yes. So he is getting he'll have his full benefit amount. And you will get 100% of his benefit amount if you are your full retirement age at that time. So, yep, 100%. And then remember, you're not going to get both checks. Here's what a lot of people mess up. And I hated telling people at that terrible time in their life that they're going to be losing essentially a full check. Because if you are receiving $2,000 a month, let's say, and then he's receiving $3,000 a month. So in the household, you're getting $5,000 a month coming in. When he passes, you're going to continue to receive your $2,000. Plus you hear, oh, you'll get his check. Yes, minus your own. So you'll get your $2,000. So you get one check, and then you're going to get another check for the difference, $1,000. So total of $3,000 you're going to get as a survivor. So one day, 1 month, you're getting $5,000 coming into the household. After that, only $3,000 coming into the household. And that always hurts. Yeah. And that's one of the reasons why we also partnered up with the dig agencies. So if you're looking to protect those people that you leave behind, because that's what it's all about, final expense, burial insurance, give them a call and see if it's right for you. And they work all over the country, and yep, and they also support this channel too. So reach out to them and see if burial insurance final expense is a good thing, and they'll check your budget and see what you can do and what you can afford. And because the most important thing is with that, if you can't continue to pay the premium, then it's useless. So you have to make sure you're able to do it on a monthly basis for the next 50, 60, 70, 80 years you're going to be around with us. So let's see. I used to live in Texas, but now live in Minnesota. I qualify for both Medicare and Medicaid now. Yep. And just when you moved from Texas to Minnesota, then when you applied for Minnesota Medicaid, then before you left Texas, you were supposed to tell them that you're moving so they can cancel your Medicaid in Texas. If not, then that's where the health insurance companies down there got money what they weren't supposed to. And that's waste. But you didn't get paid extra, right? And what should happen, because and as I mentioned, even if you did, it might take Texas a month or 2 months or 3 months to get caught up, and they still pay that insurance company for a month or 2 months or 3 months. So the new thing that's not going to do until 2029 is supposedly going to end that, and hopefully someone does that sooner rather than later. So let's see. Our checks are not going to stop, only change how they will be distributed. Everyone will get paid. Thank you, Doctor, for your advice to everyone. Yeah, thank you. Yes, please pass that information. That's the same thing when, DOJ took over Social Security and they said they're going to shut down the agency and stuff like that. It was a lot freaking people out, and they were saying that everybody has to come down and give their ID. And people thought even people filing that are already receiving benefits have to go down to the local office. And people were stressed out throughout the country. And it was only if you're filing a new claim online. And the current administration does the government has always done a really, really good job about freaking people out. So, and social media is doing a phenomenal job at freaking people out. So, Bella, this has nothing to do with Dr. Ed is talking about. Have you heard Trump is trying to make martial law in America? Okay, let's see here. Get into some Social Security type stuff. It will cost me and my husband way more to be on Medicare. We really can't afford it. If you can't afford the Medicare, the Part B, Part A is free for zero, not free, you paid for it, but you paid for it in advance. Zero premium for Medicare Part A, The B is $185. If you can't afford that, make sure you apply for Medicaid, and hopefully, yeah, they can help you out. I did Ticket to Work for 9 months in Texas. Now that I'm in Minnesota, can I go back to work without losing my benefits? Okay, you can watch my video yesterday and I detail this, and go onto my website and it gives all the details about this. So Ticket to Work. So that's different than the trial work period. So did you do the 9 months of trial work period? So you've used all your trial work period. If that's the case, I mean, you can still go back to work. You just have to stay under the substantial gainful activity, which is the $1,620. So, but if you're allowed to, if you're able to go back to work because your disability got better, medication, surgery, or something like that, then yeah, all means, yeah, everybody wants you to go back to work and make more money and pay more taxes and get off Social Security, and yeah, and I'm sure you do as well. But in terms of if you're going to keep disability, we're talking about SSDI here. If you're going to stay on disability, yes, you can work up to $1,620. So, but I would call and see whether you actually used all 9 months of your trial work period. But because if you didn't, then those 9 months you can make as much as you want. So let's see if I can find some new people. I just used Chapter to switch to a supplement. Can't thank you enough. Awesome, awesome. Yeah, you can. If you have a Medicare supplement plan right now, like a plan N or a G or an F or whatever, you can switch that 365 days of the year to another plan. But depending on your state, you'll probably have to go through health underwriting, which is, it's not a physical necessarily. They just ask you, like if you call Chapter, they just ask you about 20 or 30 questions. And if you answer no to most of those, then you can get a supplement and maybe save yourself some money. So, but if you have a Medicare Advantage, then it's a little bit more difficult to switch. And you can only basically switch if you move, or if your plan gets canceled, or during the annual enrollment period. So starting, October 15th, when the new annual enrollment period starts, if you want to switch to a Medicare supplement, make sure you call Chapter or whoever helps you out and say, hey, what are my options? Can I switch to a Medicare supplement? How much is it? Based on my health, do you think I will be approved? And all the rest of it. So let's see what else we got here. And we've also got some video questions. So I might get into video questions here first. Let me see if I can find another. Okay. I have dual coverage in New York, where Medicare cover my monthly and basic coverage of Medicare. If you know how much cash in bank I'm allowed to keep in bank, I heard about 2,000. Yeah, every state is a little bit different. California, quite a bit up there. For like SSI type stuff, it's 2,000 for single, $3,000 for married. But yeah, New York is a little bit different. And my new website, I'm going to have a separate page for every state, because Medicaid is different in each state. So when the new website comes up, it's going to have all that. But in the meantime, yeah, just reach out to Medicaid in New York and say, hey, how much can I have in resources? And remember, a lot of those. So if you all of a sudden get some money coming in, you win the win the lottery or slots, or get an inheritance or something like that. You reach out to Medicaid and say, hey, I got this money. Sure, I got $5,000 and it's over, but I need to buy a new car, fix my car, weatherize my home, pay medical bills or whatever like that. If you do a spend down type stuff, usually the states allow you to do that. So, all right, let's get into some video questions here. Let's see what we got.
It's Debbie from California, and I'm calling on behalf of my father-in-law, who's 87 years old. In 2000, he retired from the city of Anaheim and was a member of IBEW, which has been providing his health insurance and will so for the remainder of his life. In 2003, when he turned 65, for some reason he only signed up for Medicare Part A, and his medical insurance was through the city of Anaheim and is employer group retiree insurance and not Medicare Part B. Our question is, can he now sign up for Medicare Part B without incurring a penalty, since he can show proof of coverage? or will he indeed incur a penalty because he has not been working since he retired back in 2000? Thank you.
Okay, yeah, it sounds like she kind of, yeah, knows. Um, you don't have to sign up for Medicare when you turn 65 if you have current insurance from work, current insurance from current work, yours or your spouse's, and that employer has 20 or more employees. So because that was a retiree plan, it is not considered creditable coverage. So yes, he can sign up for Medicare Part B starting January. The enrollment dates on all this stuff is crazy. The Medicare Advantage to change your plan October 15th to December 7th. The general enrollment period is January, February, March. It's all crazy. So anyway, so in your particular case, he can sign up starting January. His Part B will start February 1st, but yes, he will get penalized 10% for every 12 months he did not have Part B. So unfortunately, he is going to be penalized if he didn't have health insurance through current work, his or his spouse's.
Okay, when you promise the 800 number, please give it. I understand you have a lot to tell us, but we do want the 800 number, and it's not on your site either. Thank you.
Okay, yeah, the 800 number is for Social Security. I don't give out my number because I'm semi-retired. So yeah, I'd be getting calls all day long. I did when I first started doing YouTube a couple of years ago, about a year and a half ago, but yeah, it just got too crazy and it's just me and my son. So sorry. But yeah, in terms of the 800 number, the 800-772-1213 is the Social Security. That's the national number. There's local office numbers, but that's the national number. The only other 800 number would be, chapter Medicare or, David Duford for burial insurance and stuff like that. So, but I like this video because I think that's Andrew Wyeth in the background there, famous American painter. And then one of my favorite paintings of Andrew Wyeth is Christina's World. And this is a much misunderstood painting by him. This is Christina, and she was disabled, and she used to have to pull herself across the field to get home. And so people think this is something different. It's kind of romantic. She's out there in the field. What is she doing? It's kind of but yeah, because she was disabled and she's all alone, and it kind of, characterizes kind of the indomitable spirit of America that, she is out there all by herself, but she is just pulling herself. So it's, I thought of that as soon as I saw the painting in the background of Andrew Wyeth. I'm almost sure that's an Andrew Wyeth. But this is how a lot of people out there feel in the disabled community and senior community. They feel like this is how they feel, that they are just stuck all alone trying to get somewhere, and they've got no help, and they're just pulling themselves along. And that's not the way, it should be. I always say when I end these videos, I say, please, 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 please take care of each other. Be there, reach out to Christina, help her up, help her get where she needs to get. And everybody else out there in the community, we're going to do the same thing. So when we build, you're answering questions now in YouTube comments, and coming on here and sharing and all the information you learn. This is you basically going out to that field and helping Christina, get to where she needs to get. All those people around you, that's exactly what you're doing. So we've got, I would argue, we have the best community on social media. So on the internet, in the country. So keep it up, people. Y'all are doing awesome. And we're going to do a whole heck of a lot more once our new website is up. It's going to facilitate people, helping people out even more. So, all right, let's see what else we have here.
Hello, good morning. My name is Chris. I have a question. Recently, I had the operation on my hand, the fourth operation, hopefully successful. I'm 62. My spouse is over 67. And the question is, if I would like to retire next year and claim my Social Security at 63, my wife will receive half of my Social Security, which will be at 63, or since she is older, she will get what is half of my full-time retirement age, which is 67. And also, if I'm not able to come back to work at all, I'll be on Social Security disability. I don't even know if I'm gonna go this way, but let's say if this happen, will my wife will be able to get her Social Security based on my record? Thank you.
Okay, good questions. Good questions. So one thing I would recommend, if you're, if you're not able to work because of a disability and you're approaching, or even now, but you're approaching 62, what you can do is file for a RIB DIB. So which means a retirement insurance benefits and a disability insurance benefits. And why do you do both? You're not going to get both checks. You'll get one or the other. But if you're approved for disability, then your Medicare starts earlier and you're not going to be reduced. If you file for retirement benefits at 62, you're going to be reduced by 30%. Why would you do both? Well, you file for disability, and that's going to take 6 to 9 months if you're lucky to get a decision. In the meantime, I'm sure you need to pay, you need to pay bills, right? So that's why people go ahead and get retirement benefits started so they get a monthly check while they're waiting for their disability. Okay. So you can file both. You can go ahead and do the retirement benefits or disability benefits if you don't need to get the retirement benefits now, or make those choices. But that's your options. In terms of your wife, yeah, she's already her full retirement age, so she will get 50% of your full benefit amount, not the reduced benefit. You have to start benefits on your record, whether it's retirement or disability benefits. Once you start receiving benefits, because you're currently married, you have to start. Then she will receive her benefit plus 50% of yours. One offsets the other. So like if she is, let's say your benefit amount is $3,000. So half of that is 15. If she's already receiving 1,000 from her own record, then she'll receive 1,000 from her own record and then a $500 from your record. So she'll receive 2 checks. They'll come in one direct deposit, but it'll be essentially be 2 different checks from 2 different accounts. Yes. So yes, that's what I would do. And the survivor benefit's different. If she's receiving the spouse benefits and then something happens to you, and then it's based on, depending on, if you're receiving disability benefits. Survivor benefits are calculated a little bit differently. So let's see here. This is a good one. Chapter found a special circumstance that got me on an F plan with no underwriting. Very happy with Chapter. Highly recommend. Okay, yes. The F plan. Those are the gold standard. Unfortunately, yeah, those are not available anymore unless you were eligible for before 2020. I think that's the date. Don't quote me on that one. I think January 1st, 2020. Anyway, but reach out to Chapter, they'll be able to tell you. So basically, because you were eligible for that before that, you're eligible for one of those F plans. So people that are newly eligible, the new goldish standard is G. And the only difference is a G, an F covers all of the 6 gaps of original Medicare. G only covers 5 gaps. The only one it doesn't is it doesn't cover the Part B deductible, $257 a year, one-time annual deductible. But Part Gs are usually a lot cheaper than an F. Well, generally, sometimes it depends how people bought the F. But yeah, that's awesome. Good deal. So in your state, F was probably the better deal. In some states, it would be crazy expensive, but it sounds like in your state, it was a good thing. So let's see, Terrence. It's crazy that in terms of Medicare Advantage, it's based on your zip code, and I've seen people that live on one side of the street, they have a Medicare Advantage, a plan available to them on that side of the street, but on the other side of the street, that Medicare Advantage plan is not available to them. It's crazy. Medicare supplements are statewide. So the only difference is basically price and, sometimes whether you can enroll or not. So the whole thing is just way too confusing. So I just received SSDI and my Medicare coverage starts in November. if I'm receiving coverage from my wife's employer, can I opt out of Medicare? Absolutely. So if you're receiving health care from your wife's current employment and you're happy with it, yes, you're gonna keep Part A. You have to keep that once you receive Social Security benefits, but that's zero premium. But B, yeah, if you're happy with your wife's employer plan and your wife is currently working, and that employer has 20 or more employees, absolutely. But I would check it out. Check out her plan, compare apples to apples, and say, okay, her plan is this much and it costs this much, and here's how much it covers, and here's the deductibles and all that kind of stuff. And if I sign up for Medicare Part B and get a Medicare supplement or Advantage plan, it's going to cover this and cover that, and how much is it going to. So yeah, you don't have to, but it might be a good idea to check just to make sure you're getting everything you need. And then you can change later. So if you're receiving SSDI, probably in your state, because you're under 65, you're probably not even able to get a Medicare supplement plan. In most places you can't. Or if you can, then it's crazy expensive and the bad plans. There's about 10 different plans. In some states, you can only get the ones that are not great. But once you turn 65, you got a free pass. You can get any Medicare supplement plan you want that's available in your state, and they don't charge you anything crazy, like more than anybody else. So, let's see. My son is disabled. He's on SSDI, and he has Medicaid in Texas. What is going to happen to his insurance? He doesn't get that much in SSDI, so how can he pay for insurance? Yeah, reach out to your politicians in Texas. As I said, if he's receiving Medicaid in Texas, then he is, in high need, because Texas is one of the cheapest in the country, and the state is really, really cheap. They don't like giving health care to anybody. And unfortunately, I'm going to be doing a video later, and I've come up with a title that everybody's moving to Texas, pretty much, because the terrible Medicaid system Texas has, based on the big beautiful bill, it's going nationwide. So you don't like Texas? Well, guess what? Texas likes you, and that process is coming to your state probably. And I'll talk about the details on that. But yeah, fight for it. Call your politicians and say, hey, don't do anything dumb. Don't kick them off of Medicaid because of this, that, and the other. And the big thing going forward is the bureaucratic disenrollments, where if you have to have a recertification for him, they drop the ball and they miss it, and you get kicked off because you're not able to jump over every single hurdle that they put in front of you. You have to do it, and you have to fight when they make a mistake, and you have to fight when they delay, and they have to fight when they give you incorrect information, and make sure you get he gets what he's eligible for. So let's see. Yeah, the F plan. Yeah, that was the gold standard. But a lot of people in the F plan are trying to bail out of the F plan, because the F plan, it depends how you buy it. I think if she got it, then Chapter got her into a good plan that's not prohibitively expensive. But some of those F plans, depending on the state and how they bought it, they are crazy expensive, because if the health insurance company is able to raise their monthly premium, they're going to raise them. And because that pool in F is getting smaller and older, then the insurance companies are like, okay, 20 years ago in our state, we used to have, 200,000 people in this pool, and they were youngish and they were paying premiums and we were making tons of money. It's a beautiful thing. But now we've got 50,000 people in the pool because the other people left or they passed away. And now these people that left over 50,000 people are costing us a lot of money, and we're not making money anymore. So they're raising the premiums. And so there's a lot of people on the F plan that are trying to bail out of an F plan to get to a G plan or N plan, but they can't because they're stuck, because they can't pass medical underwriting. So the health underwriting. The whole thing is crazy. Super long story short. So I'm not going to do an acting on that, a recreation of that one. So I'll maybe come up with one in the future. Okay, we are at an hour, and we are over time. And I appreciate y'all. And I will be back again tomorrow, and make sure you're dressed. Yep, I'll be back again tomorrow. We'll talk about another question, another topic of the day, and then we'll get into your live Q&A. So remember, please, 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 please take care of each other. Bye-bye.